Kuan-Gen actually is the president. We are honored to have him today here. He's the president of Taiwan Association for Minimally Invasive Gynecology in Taiwan. He's a chairman of a Kuan-Gen Memorial Hospital International Fellowship Gynecological Endoscopic Training Program. And he's also an associate professor, Kuan-Gen University, Taiwan, and associate professor of Department of ONG, Kuan-Gen Memorial Hospital, Taiwan. And he also an editor of Gynecology and Minimally Invasive Therapy, which is the official publication of APAGE. Dr. Huang also is a teacher of many experts of laparoscopic across the world today. So Dr. Huang, are you ready? So
yeah, I'm ready. So
okay, let's pass the lesson to you. Yes.
So I start my lecture now.
Yeah, you can start your lecture now.
So I just put. Can you see my slide? Can or no? Can you see my slide now? Okay.
Yes, you can see a slide. You're going to change it to a slide presentation.
Yeah. It's okay.
Yes, very good.
Okay.
Go ahead.
So it's my honor to be here. I have some nervous about the webinar meeting because always we surgeon always is more comfortable in operation room, but not in the meeting room. Yeah, but because committee assigned to me about the topic is training and accreditation in gynecological endoscopy and minimal invasive therapy. So I just want to share some experience. I have been this field more than I think 25 years already. So I think the most important is not you do the surgery, but you must have some training, because without training, minimal invasive surgery may be a maximum invasive surgery, because always there are many complications. Everyone knows we must have a training, but the problem is there's limited the teaching program and no standardized. You can see some surgeons, some teacher, but they no standardized training program. I think so. We are surgeon, not a drug. A drug is uniform in the world, but surgeon is unique. So every surgeon is different. But we back to the learning theory. I think that's the basic. Even now, I think it's most important is you can see one, do, and teach one. That's very traditional. But in the modern day, we must think more deeply, especially in the learning theory, because some part is cognition, but some part is behavior. That's a different part. You, like today, you just attend the lecture, reading. That's sometimes you know something, possible know how, but different, because we are surgeon, we must show how, become more confident, and we must do. So we are surgeon, we must practice by doing, but that's a problem, because your knowledge how to apply to your daily practice. So in the learning theory, what did you learn most? You just lecture only 5%. Like today, you attended the webinar. What you can learn only about 5% only. You can read it yourself. You can see some video. You can see some demonstration, but only below 50% you can get. You do practice and discuss with group, then you can learn more about 50. And I think in recent years, I think if you can teach some others, you can get much more. Because especially some more complicated surgery procedure, in the behavior approach, we can break down into specific component, some component. First of all, in the observation, you know the cognitive phase, then you can associate different phase, then you do, then become more automated. Yeah, that's a process. That's I think and that's our learning theory, especially in the surgical skill. And you cannot do a surgery, just see one, do one, and you do every day. No, you must frequent and repeat. So you can become more competent and become a good surgeon. So, and you learn from each procedure. So some is a visual space organization. That's why we must have basic a training program. Somatic sensory memory. So you repeat, you repeat. And sometimes I think this recent years, I like to focus on the so-called stress tolerance. Because you are not competent, you just can do some basic surgical procedure. But if you want to progress or want to do more complicated procedure, you must tolerate some stress because you are fear. You fear over some complication because you are not familiar. So that's a step by step. Yeah, so then you can have a tolerate the stress. The stress is your competent. You can tolerate it. Then you can become more skillful. So we must the program is incorporated in the theory. So I just share some our training program in APAGE learning theory, and you know how to learn is one thing. How to teach is another thing. If you want to learn it, that's the you can get into the fellowship play. But you want to be a trainer, a teacher, you sometimes you must know the mental space. The mental space is how to teach a student. We are surgeons, so every day we do some practice. So for the VR is the fourth, and we repeated to do it because you repeat the same procedure. You repeat the same procedure. But so be a surgeon. Observation is not sufficient. It's not enough. But you cannot do surgery in that patient if you are not competent. So that's why we must have a teaching program. Yeah, and we must have some supervisor. Yeah. So I just ask the new gynecologist, you want to learn something, you must learn every detail. You know every detail, so you can become an expert. And for an expert, I just ask them, keep humble and keep low. Then you can learn the new one. Otherwise, you just do the old style, and cannot improve yourself. So our APAGE education, the workshop major domain, we have the education lecture, but the lecture is skill-based because we just want to learn. That's the major part is a skill. We have a video analysis what the surgery is good and what part is not good, even it's wrong. So we must have a box training. Box training, we have a portion animal lab, and sometimes we have cadaver workshop, and we have a live case demonstration. So because the animal lab is more expensive, but it's a good way to be standardized the learning program. So we can learn the standardize. You want to learn something new for more advanced endoscopy technique, please, and join the hand-on animal lab first. And so that's the, if you want a basic, just a dry box, because animal lab is more expensive. So this animal lab is just focus on the advanced endoscopy program. And because we are surgeon, you want to become a more focused expert in MIS field. We have a fellowship training program, because not all of the risk scenario can be stimulated in the animal model. And the fellowship is a comprehensive training course. Because APAGE is a larger organization, we have flexible training program, but the standardized, the original, the most popular fellowship training is 1 year. It's 1 year. Our goal is you become a competent surgeon. Just our goal. From a beginner, or you just know endoscopy, you do not do anything, then become an advanced beginner, then more competent. But if you want more part, you want to be expert, you must do your skill by yourself. So just the novice, yeah, and step by step. That's yeah, and then everything from your daily practice, attend the workshop, discuss with the expert, then you become more skillful. So that's our in Chang'an Memorial Hospital, that experience. Accommodation is free. It's very good, and the life expect every day, yeah, the spend easy to daily life, yeah, and we our 1 year program. We have observation, everything, dry lab, hand-on animal lab, video edited, paper writing, and hand-on surgery. Yeah, that's our program. The observation, we have a many procedures, from histoscope, laparoscope, uterus, ovary, and single pole. Even we have a notice. And oncology surgery, infertility, urology, robotic. Sometimes we even have fetal scope for some specialty and expand their field. And also my philosophy, the training is not only skill, we have life, friendship, connection. So we are family. Just like Ajura, yeah, that, I think that's more than 10 years ago. The doctor comes from Thailand, Philippines, that's Armenia, that yeah, many countries, Thailand, I think the Philippines, and Allah, that comes from Middle East country, yeah. So we can have a good connection and get joined in one space. Our space is a good training center. So you have a good connection, thinking, discussion, and learning in this 1 year. But also we think that you must have some writing. Why? Writing is one part of our training. Because if you want to write a paper, you must search everything, constructed comprehension thinking of your surgery about the topic. Yeah, during revision, you know which part is more important, which part must be more focused, so you can learn many things. Our article is flexible. You can from image, case report, or original, or the review style. It's okay. It's okay because our purpose is training, not for study, academic study, not the major part. Our major part is training. So we just, you know, the program. We also have our official journal, Gynea. Yeah, that's a very easy online submission. Yeah, that's some part. That's Irura. Thanks, Irura. I always know you write one paper. This one, I think many times I show the paper you write, and like the Anita, Malaysia, gynecologist come here, write many paper. That's even, this is not only for MIS. Yeah, like this is very special for oncology field. That's the automated stem cell. Yeah, you can write if you want to learn. We can afford. We can have many material if you want. Yeah, like this paper, Dr. Anita here cooperated with some doctor from Portugal, Argentina, Thailand, Philippines, create. So that's very, very good cooperation, comprehensive, and you have a good connection. Dr. Chua, yeah, have a very good, even, yeah, like, I think that's this year just published in our Taiwan official journal, very good. The article about the standardized about the laparoscopic radical hysterectomy. But even image, one image, you are interested, you can write it, publish it. Yeah, we ask publish. Yeah, like the rare variant of obturator artery. That's our surgery from the internal iliac artery. Yeah, Dr. Chuan just finished a paper published. And not only writing, right? We are surgeon. We must have some practice, because I always know if I hear you just attend the webinar, you forget tomorrow. You see me, yeah, you can remember, but you do it, you can understand why the procedure, how to perform a good surgery. That's I think it's very good. The best way to learn it about the energy is by doing. If you do it, you can learn everything, detail. So our training is one-on-one, hand-by-hand training. I think that's I do that. I always keep this picture under supervisor. So the patient is safe. I must say the patient is safe because many experts around the patient see everything, do the best procedure. You can, how many? Yeah, the Dr. Lee, me, and some expert here. Everyone sees the procedure, so the patient is safe. Yeah, you can, that's like the Anita and the Muniati from Indonesia do the surgery under supervisor. We have video discussion over, because we want to become professional. We want to be more professional. Yeah, after training, 80% international fellow become a professor or a chair in 10 years. Yeah, you can, this just graduate is Dr. Chua. So I think Dr. Chua can become a chairman 10 years later. Yeah, that's Dr. From Japan is the chairman, and Aranya in Thailand, in Philippines, they organize, that's the Bangkok, they organize a training team in their country. I think that is good. Yeah, we are training team. Not only me, not only Dr. Lee. We are training. We have many methods. We have many. You can learn some part from every teacher. Then organize, become yours own. Yeah. So our skill is not skill, but also philosophy. Not training, but also education. But also by education, not only work, but also life. Not only domestic, but also international. We organize our training program step by step. Then another thing is about the accreditation, because the committee asked me to talk something about the accreditation. Sometimes I like to talk about the education training, but I do not like to talk more about accreditation, because sometimes it's not so easy, because the accreditation is always official. Sometimes the accreditation program limited. Someone can do something, someone cannot. So sometimes become political. So, but I think now we must have some accreditation for minimal invasive surgery, because training is not equal to accreditation. Training, you can get a certificate, but not means you have the ability. But accreditation, you get some ability certificate. For the accreditation, we can focus on the surgeon, we can focus on the hospital, we can have a training center, or can be accredited. Accreditation, but I think surgeon is most important. Surgeon is most important. So I think that why I like to talk something is because about famous, but also notorious, because the training is like a clinical trial, but follow the new drug trial, and the participation side is only 10 laparoscopic or robotic radical hysterectomy can enter the trial. And the final result, I just want to say the right final result, the MIS lower survival outcome and higher death rate and local recurrence. But our common is 10 laparoscopic hysterectomy is not enough, is not qualified for endoscopic oncology surgeon. Because we are surgeon, we are not a drug. Drug is uniform, but surgeon is variant. The make a drug is important, but the surgeon most important is training. Yeah, clinical trial is important for drug, but training is most important for surgery. So accreditation, we just want to qualify the surgeon. So, and if we have accreditation program, it's more justly for good surgeon, and it's also for safe for patient. So we need accreditation for mini invasive surgery. I think the center is for the patient safety. Yeah. So we are gynecologists. We must, because we can reduce the complication. And so it's safe. for patient itself, for patient accreditation. Yeah, like in Japan, Philippines, South Korea, Thailand, Taiwan, but I don't know how about in Malaysia. But APAGE pastor want to organize or in this area a common rule for the accreditation system. But for example, we come from TAMIC, Taiwan Association for Minimally Invasive Surgery. You must have a specialist for Taiwanese OBGYN and doctor. You can have at least 2 years experience. You must be a member. You must attend and pass the workshop, symposium held by TAMIC or APAGE. We do not want to limit it, so we adopt just a loose criteria. You must have a paper documentation, and you must have your video. You must have experience, and you must have passed our accreditation committee. You must pass our oral organization, and the accreditation is not lifelong. We always just valid is 6 years, 6 years. But the continuity fee is very low. In this 6 years, you must continue to attend the education symposium. You must have some oral presentation. Keep your expert experience. Keep your surgical skill. So we have a very uniform and the content. You are a general laparoscope, histoscope, robotic, or even HIFU, urology oncologist. Yeah, that's our plan. You are our plan to be specialized. You can be a general. So that's the paper, our OBGYN specialty accreditation in Taiwan. And this is for minimal invasive surgery certification accreditation. Yeah, the value is 6 years. So in conclusion, I think training education is most important for minimal invasive surgery. Yeah, minimal invasive surgeon must earn independent as a specialist. Just another, if you are an OBGYN doctor, then can I do MIS surgeon? No, because it should be independent and independent, because that's a special skill. Accreditation is crucial for patient safety, and accreditation is also for good surgeon. That's our goal. So best is from national government accreditation process is better, but at least like the Malaysia Endoscopy Society, like the Taiwan GYN Endoscopy Society, we can offer the academic accreditation for our member, our surgeon. That's my talk. Hope you can hear.
Yes, thank you, Dr. Huang.